Hey everybody, it's Sullivan Gallagher here, and today we are here with CEO of Adventist Rideout Hospital here in Marysville, California, Rick Rawson, and we are talking about what's been going on in the healthcare sphere during the COVID-19 crisis. Adventist obviously has been a great partner here locally as we've been trying to manage this, Rick, maybe first I'll just kind of start off by asking you, what is the current status, here at the hospital? A lot of people have been concerned about capacity, and do we have capacity for whatever surge or cases that we might see? Maybe you can just kind of give us an update as of today, August 18th. What is kind of the status of where we're at in the hospital?
Yeah, so our hospital is a busy hospital with or without COVID. So we, like right now, we're running very close to capacity. We've got a lot of patients that will be discharged, and we'll have room for patients that are coming in and planned surgeries. We have our census of COVID patients has stayed relatively stable over the last 3 to 4 weeks. We've been in the mid-20s, which is still there today. We're not seeing the decline they're seeing in other parts of the state right now. But we're not seeing dramatic increases like we did 3 or 4 weeks ago.
Talk to me a little bit about, a lot of people express concern about ICU capacity. Where are you guys at in your ICUs? And is it common for ICUs to be kind of full, at different parts of the year?
Oh yes, ICUs can be full any time of the year. I think what's unique about COVID is that as the disease progresses, it requires mechanical ventilation, which requires ICU level of care. And so there's a lot of focus on ICU capacity for that reason. But we do open heart surgeries and a lot of other things that require cardiovascular ICU care. And so, our ICU is a very busy place. I think the last I saw, we had 5 available open beds in our ICU. That could change in a day. I think a few weeks ago we were full looking to transfer patients that needed ICU level of care, and by the midday the next day we had enough capacity, and we're in a much more comfortable space. So it can go up and down just depending on what comes in. When you have an emergency room as busy as this one is, where we do anywhere between 170 and 200 visits a day, things can change rapidly. But we have a team of doctors and nurses that are used to that.
And many of the cases that come in, people recover, don't have as serious conditions. But I think the thing that often people wonder about is, hey, what if I do have more serious conditions? Is the hospital going to be able to manage the cases that come in? And what would you say to people that ask that?
Yeah, I think the answer is yes. And I think we're involved with hospitals across the country and what we're learning in real time about the best way to treat this, the COVID patients specifically. Early on, especially when New York was spiking, everyone was getting ventilated quickly and right away. Now they've backed off using high flow nasal oxygen when necessary and only ventilating as necessary. They've also found drug treatments that are helping them manage the cases they have as well. And so I think the physicians are feeling pretty comfortable in terms of their ability to take care of the patients. Unfortunately, there's no secret cure out there. They're learning in real time along with the rest of the world on how best to treat patients, and I think we've seen that in a reduction of the mortality rates, even with higher caseloads. But I think it's also important to realize that mortality isn't the only bad outcome. There's a lot of data now that people that do get hospitalized can have lifelong damage to vital organs that could potentially shorten life later on. So there is concern. I think it's still important to prevent it as much as possible.
Right, and you highlighted that a lot of our cases are coming from family gatherings or people getting together in large numbers, kind of on their own personal time. What we aren't seeing is that it's not coming from restaurants, it's not coming from gyms or fitness centers or barber shops, salons. most of our cases are really coming from that. And so part of this is really just letting people know that, hey, the way that we can best protect our community is for you to heed that guidance, which is avoiding these larger gatherings, and being careful when you're going out in public. Right?
Well, and I think that's it. And I think it's really all about risk mitigation. You know, everything has some percentage of risk. The question is what we do about that in those settings. It isn't the setting that that passes a virus, it's what happens within that setting.
Right.
And so if people are vigilant about wearing masks, distance, cleaning, all those things that they put in place, even if it's inside, there's less risk. You know, the reason I believe they support outdoor dining is there's less risk outdoors than in tight and closed spaces. But I would say when we initially did the reopening, there wasn't a lot of care and vigilance in terms of what was happening in certain spaces. Some businesses did well, others it was challenging, but it's new. You know, we're all learning, and you know, I think it's not a time to judge and condemn our community and each other. It's really a time to embrace and love our community back to better health.
Right. And you mentioned, I mean, so we've had the higher cases, overall cases in the Yuba Sutter area, but really in terms of hospitalizations and our case mortality rate, those numbers have actually been better. I mean, can you speak to that a little bit?
Yeah, so as I said, hospitalizations are higher than we like them to be, but they're flat. They're not growing exponentially, which is good. You know, we're probably in the mid-20s every day. I think we have 28 this morning. In there with 5 in the ICU. We've been as high as 9 in the ICU. And so we've seen that pretty steady over the last few weeks. And as I said before, what we're seeing in some of our sister hospitals around the state, their numbers now are starting to come down in San Joaquin County and the Central Valley. And we're hoping to see that trend start tracking here as well.
Well, hey man, I appreciate you taking the time today. I mean, I think you've answered a lot of great questions that are on people's minds. And again, I appreciate you know, we worked together early on to ensure that we got testing, you know, to this area. That was a very big issue. You know, we continue to work on PPE and ensuring that, you know, people have adequate supplies. Your team has been phenomenal. You know, I mean, all from the doctors, the staff, all of the physician's assistants, everybody who's been involved in this operation, you know, I think has been a key part of helping keep our community safe and ensuring that we have the healthcare infrastructure in place to manage this crisis. So I commend you and your team for the work you've done.
And we really appreciate your engagement in this and leadership. That's been valuable sometimes when we needed attention from the state in different areas, and from day one, you've been there for us, and I just really appreciate that. And then, you know, the county leadership, I think, has been extraordinary under very difficult circumstances, you know.
Well, you know, we're always willing to go to bat for you.
That's right.
You know, it's my pleasure and honor to do that. And like you said, it's been a team effort, and we're going to continue to keep working through this as a community.
Fantastic.